So the purpose of the Rapid Response Cardiac Clinic was to address a need in the community in general, in that patients can't get in soon enough to be seen by heart specialists. As you know, heart conditions can be immediately dangerous or life-threatening, and whereas other specialties may be able to wait weeks or months for patients to be seen, that could be a significant problem when it comes to cardiology. The immediate catchment area that we're looking for are patients coming out of the ER, because they may not have a cardiologist assigned to them. They didn't have an immediate problem, but the emergency room physicians feel that they need to be seen soon. The second major group are people coming out of the hospital that have had heart problems but can't get in to see the cardiologist that was seeing them there in a reasonable amount of time. When they're coming out of the hospital, it should be in less than 5 days that they're seen. And the purpose of this clinic is to see patients within 24 to 48 hours, Monday to Friday, 8 to 5 as necessary. In addition, we have a general call center called the Patient Navigation Center, the PNC, and they will often get cardiology calls and try and schedule patients and can't get them in for weeks or months sometimes, and they can schedule them with us too.
So we do an EKG here, but if the patient has an abnormal EKG, then I'll go ahead and do a stress test maybe and a CT calcium score, looking at what is the calcium buildup in the coronary arteries. We do send them to our cardiology office, or we send them to the imaging center right around the corner, all part of Holy Cross. So we do want to give them peace of mind that we're here to evaluate them and get their procedure testing done as soon as possible, and refer them back to their primary if there's other worry, if it's not a cardiac reason or purpose.
So this is not a longitudinal clinic. What I mean by that is that we're not following patients here. We get them into the system, we initiate the workup, and we hand them off to my partners. I have 10 partners here who do everything in cardiology, from catheterization to stent placement to valve repairs and fixes, to electrophysiology and other rhythm disorders, to heart failure, etc. So the purpose of this clinic is to get them in, to have them initially worked up, and then if we find anything, they're handed off to a physician in the Holy Cross Medical Group and Cardiology Associates for their long-term care. If we screen them and everything is fine, we'll bring them back and tell them, look, everything is fine. If you need us again, come back and see us, but there may be no need for long-term care.